Chapter 5 covers the innervation of the face and scalp. There are two study objectives here. First, describe the innervation of the face and scalp. Second, predict the deficit expected following injury to each of the major nerve branches. In examining the innervation of the face and scalp, we must recognize three different nerve groups. First, the trigeminal nerve, or cranial nerve 5. Second, the facial nerve, or cranial nerve 7. And third, a pair of cervical spinal nerves, the greater occipital nerve. The trigeminal nerve, cranial nerve 5, is the major sensory nerve to the face and scalp. Intracranially, the main stem of the trigeminal nerve splits into three divisions: the ophthalmic division, the maxillary division, and the mandibular division. These three divisions are commonly abbreviated by using a combination of Roman and Arabic numeral designations. So the ophthalmic division is often referred to as 5-1, the maxillary division is referred to as 5-2, and the mandibular division is referred to as 5-3. Ultimately, each trigeminal division spreads across the face and scalp. The ophthalmic division supplies the forehead, the upper eyelid, and the nose. The maxillary division supplies the lower eyelid, the upper part of the cheek, the upper lip, and the anterior part of the temple. The mandibular division supplies the lower cheek, the lower jaw, and most of the temple. Each of the divisions sends multiple cutaneous branches to specific parts of the face and scalp. The next series of illustrations will outline the details of this nerve patterning. This is a schematic frontal view of the face and scalp. Each of the division territories is shown in a different color. Let's identify the individual nerves that supply each territory. First, let's look at 5 branches that are derived from the ophthalmic division. These are the lacrimal nerve, supplying a small territory on the lateral part of the upper eyelid. Next is the supraorbital nerve, supplying a very large territory across the forehead and up into the scalp. Next is the supratrochlear nerve, again supplying the forehead and up into the scalp, but a smaller territory than the supraorbital nerve has. Next is the infratrochlear nerve, supplying a small area along the medial part of the upper eyelid. And finally, the external nasal nerve, supplying the skin along the external part of the nose. We can recognize 3 branches derived from the maxillary division. The infraorbital nerve has a large distribution territory across the mid part of the face. More laterally, the zygomaticofacial nerve has a small area around the cheekbone region. And finally, the zygomaticotemporal nerve has again a relatively small territory across the upper part of the cheek and lapping up into the scalp. 3 more branches are derived from the mandibular division. These are the mental nerve, emerging from the chin and supplying the skin in the lower lip region around the chin. The buccal nerve, which supplies the area of the cheek. And finally, the auriculotemporal nerve, which has a large territory of distribution to the external ear, the temple, and well up into the scalp. This is a schematic lateral view of the face and scalp. As before, each of the division territories is shown in a different color. Again, let's identify the individual nerves that supply each territory. In this view, we can recognize 3 of the 5 branches of the ophthalmic division. We can see here the supraorbital nerve, the infratrochlear nerve, and the external nasal nerve. Again, 3 branches come from the maxillary division: the infraorbital nerve, the zygomaticofacial nerve, and the zygomaticotemporal nerve. Finally, 3 branches are derived from the mandibular division: the mental nerve, the buccal nerve, and the auriculotemporal nerve. This drawing shows a dissection of the face that focuses on the trigeminal cutaneous branches. The 5 branches that are derived from the ophthalmic division are all visible in this view. Again, the lacrimal nerve, the supraorbital nerve, the supratrochlear nerve, the infratrochlear nerve, and the external nasal nerve. We can identify 2 of the 3 branches derived from the maxillary division: the large infraorbital nerve and the smaller zygomaticofacial nerve. In this drawing, we can also identify 2 of the 3 branches that are derived from the mandibular division: the mental nerve and the buccal nerve. Trigeminal neuralgia is an idiopathic irritation of facial branches of the trigeminal nerve. The condition is characterized by sudden, brief attacks of excruciating facial pain. This usually is limited to the unilateral area of distribution of a single trigeminal division, usually the maxillary division. The pain here is so intense that the patient reacts by repeatedly wincing, which causes a tic of the facial muscles. Thus, the condition often is termed a tic douloureux, which translates literally to a sorrowful tic. The facial nerve, cranial nerve 7, is the motor nerve to the facial muscles. The facial nerve emerges from the skull through the stylomastoid foramen, an opening in the base of the skull located between the styloid process and the mastoid process. As it leaves the stylomastoid foramen, one branch of the facial nerve, the posterior auricular nerve, turns up behind the ear and distributes to the muscles in the posterior scalp. The main stem of the facial nerve curves forward into the parotid gland, divides into 5 terminal branches, and supplies the facial muscles. The terminal branches are as follows: the temporal branch, which runs up into the region of the temple; the zygomatic branch, that runs into the area of the zygomatic bone; the buccal branch, which passes into the soft of the cheek; the mandibular branch, which courses into the lower jaw region; and the cervical branch, which runs into the neck. Take note of the buccal branch of the facial nerve. It's important that you do not confuse this with the buccal nerve, which is a cutaneous branch of the trigeminal. Note the important relationship of the facial nerve stem and terminal branches to the parotid gland and the masseter muscle. The nerve runs through the substance of the gland itself, while remaining superficial to the masseter muscle. Parotid diseases, such as tumors, may place direct pressure on the branches of the facial nerve where they pass through the gland, causing possible damage to the nerve and compromising facial muscle function. Therefore, the distribution of the facial nerve must be carefully considered during surgical invasion of the parotid gland. In the adult, the mastoid process is a pronounced projection that covers the stylomastoid foramen laterally and protects the facial nerve stem. In the neonate, the mastoid process is undeveloped, and the facial nerve stem is relatively exposed. This absence of the mastoid process at birth places the emerging nerve in a position of potential danger, for example, during a forceps delivery of the head. The following dissections show the terminal branching of the facial nerve. Notice that each branch may have considerable overlapping territory with its neighbors, and that the branching pattern is subject to much individual variation. This dissection shows temporal, zygomatic, and buccal branches emerging from the parotid gland and passing on to their destinations in the face. In this dissection, the parotid gland has been removed to show the facial nerve exiting the stylomastoid foramen and dividing into its terminal branches. This dissection is similar to the previous one. Again, the parotid has been removed to show the branching of the facial mainstem. Bell's palsy is an idiopathic paralysis of the facial nerve, usually to its terminal facial portion. The effect may be short or long-term, and may involve all or part of a unilateral nerve territory, although usually all of that side of the face. The specific presentations of a Bell's palsy include a mask-like, expressionless side of the face, an inability to tightly close the eyelids and lips, dribbling of food and liquid out of the side of the mouth during chewing and drinking, and an inability to whistle, pucker, blow, or suck. The patient shown here has a Bell's palsy on his left side. Notice his inability to fully close the eyelids and the inability to elevate the lip on the left side. This section will describe the innervation of the scalp. There are few motor nerves to the scalp because of the relatively small number of skeletal muscles there. All of the motor nerves in the scalp are branches of the facial nerve. The temporal branches of the facial nerve supply the frontalis and the anterior and superior auricular muscles. The posterior auricular nerve supplies the occipitalis and the posterior auricular muscles. There's an extensive overlapping network of cutaneous sensory nerves supplying the scalp. These nerves are arranged in two main groups. The nerves anterior to the ear are all branches of the trigeminal nerve. The nerves posterior to the ear are all branches of cervical spinal nerves. Anterior to the ear, we can recognize the supratrochlear and supraorbital nerves, both of which are branches of the ophthalmic division of the trigeminal. We can also recognize the zygomaticotemporal nerve, a branch of the maxillary division, and the auriculotemporal nerve, a branch of the mandibular division. Posterior to the ear, we can recognize the greater occipital nerve and the lesser occipital nerve. The greater occipital nerve is the larger of these two and is a continuation of the dorsal ramus of the C2 spinal nerve. The lesser occipital nerve, as its name suggests having a lesser territory in the scalp, is a continuation of the ventral ramus of C2 through the cervical plexus. Another occipital nerve, the third occipital nerve, is not shown here. This nerve might supply a small area near that of the greater occipital nerve. The third occipital is the dorsal ramus of the C3 spinal nerve.